Hi, my name's, I don't think you could hear me there. Hi, my name's Amber, and I was part of group 5. This is my recording of the final questions. If you see me glancing down, I'm reading the questions off of my phone. So the first question, how does one determine what stage of Alzheimer's they're in, like stage 2 compared to 3, 4, or 5? That can be done using the Barak staging, and that's based on how many, where the tau tangles are located in the brain at the moment. And also you can look at the brain, and this is more done post-mortem. You can look and see how much the brain has atrophied. Another way to tell is based on how much cognitive impairment the patient has. So if they're just slightly confused, but usually know where they are, then they're in stage 1. If they're more confused or starting to forget common events that have happened more recently, then they're getting into later stages. Once they lose their ability to control their bowel movements and become very irritable, they're getting into the later stages. Okay, question 2. Is there a way for the removal of these mRNAs to slow AD down? As of now, we do not know. We just know that they are indicators that that Alzheimer's disease is present. So possibly in the future, more research needs to be done. 3. We mentioned in the future comparing expression in the brain versus the biofluid could help earlier diagnosis of Alzheimer's disease. Could this biofluid come from any secretion of the body? Should there be further testing to determine which biofluids contain the proteins of interest, or are they universally consistent? This fluid is usually going to be the blood or cerebrospinal fluid. So those two fluids, I believe they occur pretty equally in cerebrospinal fluid versus blood, but any other fluids, I don't believe you'd find them there. Okay. Was the difference in the amount of mRNA interaction with amyloid beta peptide tau and the different cytokinesis in the IFG versus the SCG regions of the brain? Yes, it was they mainly interacted with interleukin beta. They mainly interacted with interleukin beta. Why do these specific mRNAs have a link to Alzheimer's disease? How do they contribute to the progression? Are they the cause of AD? They are not the cause. Alzheimer's disease is a very complex condition, and we have not found one specific cause. So they are not the cause. They are an indicator that it is present. They might cause some of it, but we don't know that yet. More research needs to be done. These 5 mRNAs were the ones that were out of the 28 that were found in many different research articles. These 5 were the ones that appeared the most often, and these 5 were the ones that had the greatest upregulation and downregulation. So it's the upregulation or downregulation of these mRNAs. We don't know exactly how they interact, we just know that they do. More research needs to be done. And the last question, if specific mRNAs can be used as indicators for the diagnosis of Alzheimer's disease, what kind of genetic tests would be used to identify the mRNA and their abundance? That would be a blood test. I don't believe there's any specific genetic test for Alzheimer's disease currently right now. If we're just testing for the microRNAs, we would just look at we draw the biofluid and we test it for the mRNAs. Thank you.